How you doing, Richard?
I'm very good. Good afternoon, Douglas. Good to see you.
Well, do you know what? I'm always happy to see you today. And I'm super excited to have this conversation because we've got somebody in the house that's going to really bring the conversation to that human level.
Yeah, I agree. That up to now, we've been sort of more about technology and system. Today, we come at it from the patient perspective, and
Absolutely.
really, really important piece in this jigsaw. And so for the first time, we can go and dig into that with Jono Broad from NHS England. Should we get him on stream and get him going? What do you reckon?
Super excited. Let's do that straight away.
Jono, good afternoon and welcome to Think Big, Act Now. Absolutely delighted to have you here. Quick intro. Who are you, Jono? What do you do?
Richard, good afternoon. Absolutely brilliant to see you. Great to be with both of you today, and thanks for the invite. Gosh, who am I and what do I do now? That's a question and a half, isn't it? Let's start with the easy. My name's Jonathan Broad, but everyone calls me Jono, and the easy way to remember that is just think of my mother. All I ever heard was John, no. I just thought it was my name. So that's me as an introduction. What do? I have the great joy and privilege of working with NHS England here in the Southwest. I live and herald from Devon and have the brilliant joy of working across the whole of the Southwest region. And I work specifically with a group called the Integrated Personalised Care team. And we literally look after everything, thinking about the patient experience. What's the patient going to get the most out of? And the reason I have I call it a great privilege is because I am somebody who would say I'm game turned gamekeeper, because for my entire life, I myself have had a long-term health condition. I have cystic fibrosis. I have had the privilege of both being killed by the NHS and revived by the NHS. So they're on a good record so far because I'm still here. And I transitioned over 25 years of being a volunteer, doing things for the NHS as a volunteer. And then somebody was silly enough to offer me a contract. And so I decided to start working with them formally.
So what do patients think from what you're seeing of what's gone on over the last year, particularly backlog, the rollout of technology at speed? What struck you? What are the headlines?
So first of all, the headline has to be how grateful people are to the NHS, that under such struggle, under such heavy workload, they were still there for us. Things may have changed, and yes, we've moved much faster in the ways of technology, the way that we engage via things like this wonderful video conferencing or telephone conversations with our clinicians and with our GPs. And for some people, that's been really scary. For some people, it's been an inconvenience rather than a convenience. But for others, it's been an absolute joy. The realization that you don't have to go somewhere, spend hours on the road in order to get to a hospital appointment, but actually you can sit comfortably in your own home and have those conversations openly. And the importance, of course, is that those conversations are held in a way that's supportive and caring. So from me to those that have cared for me personally, I love you dearly. Thank you ever so much. From your patients, I think the overall response would be, we are overwhelmed and grateful for every second you've done for us.
You touched on something there, that issue about doing something from your own home and connecting with your carer in that way. You almost imply a greater intimacy, but I don't know if that's what you intended or not, but that's because a lot of people would say technology actually removes intimacy and treats everybody the same. But is that right?
In some ways, I remove some of that intimacy. You'll see my background today. It's got the logos of places that I work and organisations that I'm proud to be a part of. But that hides something. That hides the fact that I'm sitting in my garage. Or for some people who don't have that, we are actually now inviting healthcare professionals into our own home because they can see our living environment. And actually, that's unusual. That's not how we used to do it. We used to go and attend and be in a very clinical environment. So it has changed the dynamic. It's changed the dynamic of how, certainly for me as a patient, I feel. And I'm welcoming people into my room, not being welcomed into theirs. And so for me, it does change that dynamic, and it is more open.
Do you feel that this changing dynamic has also changed the patient-clinician relationship? The NHS is in the spotlight all the time and having a lack of resources, people to actually deliver care. And the patient is an untapped resource, for want of a better word or expression. So it's a twofold question. One, in terms of some of the technology that's been brought in through the COVID pandemic, home consultations, visual consultations, do you think that's going to stick? And also the role that patients will then play?
Yeah, absolutely. So let's take those two things slightly differently. Will the technology stick? I think it has to. And the reason I think it has to is that let's think about both the human experience of healthcare and the wanting of people to be involved in their care. But also, let's think about the planet on which we live. Can you think of the carbon footprint that's been saved, stopping patients and staff having to drive to certain units all the time? And the fact that actually we've got an environmental saving by doing it the way we're doing it. And as far as the other technologies, a lot of people are saying these technologies were introduced due to COVID. Actually, these were there beforehand, but hadn't been as widely used or widely introduced. And one of those for me are the access to the care records that patients now have. They were there pre-COVID, but we've used them so much more. And it enables me to be properly involved in the looking after my care record, my notes, understanding the medication that's being given to me, much faster ordering of medication. As an example, this week alone, ordered medication one day, pharmacy phones the next, it's ready and done. That used to take 5 days to a week because it used to go via fax and get sat on a side for however long whilst it waited. Yeah, all of the technology advances we've got to keep because of the benefits that they really are giving.
And Jono, I hear clinicians, healthcare professionals at times say, oh, my patients won't use this technology. And they sometimes make an assumption about age or their socioeconomic background or whatever. It makes no odds. I worry that that's an assumption, but who's right, who's wrong? What's your sense of what's going on?
So let's get right back to personalised care. Okay. I believe that the future will be a personalised choice. Has this worked well for you? Do you like it? Let's use it. Did the previous way of doing things work well for you? Why can't we have choice in how we attend? Do you want to attend digitally? Do you want to attend by phone? Do you want to attend in person? Let's give option and choice to patients in all that we do and not make the assumption that it's for everyone. Mm-hmm. Let's also remember that in the UK, somewhere between 13 and 20% of the population do not have either capacity or access to digital. Now, we have to understand that you cannot shut out a part of the population by making a choice to only do things in a new modern digital world. So we have to ensure that we are caring for everyone equally and with equity. And for me, that's about choice and about ensuring that the discussion is had openly with patients to ask them, what is it that matters to you? How am I going to serve your needs best? And then we serve them in that way.
Sure. And all of those things you mentioned there almost reshapes the patient relationship. Being the word patient, I think you're touching upon consumerization of health, where you're viewing people as consumers opposed to patients per se.
So I'm very conscious of the word consumer because it immediately brings people's thoughts to an Americanized system or to a financially based system. I would much rather be talking about patients as partners within their healthcare. The classic for me in the old medical model is when we talk about the way in which we get teams together to discuss patients. And it's the clinicians that get together or the support teams. And the person that's missing always is the patient. And actually, I'd rather be looking at multidisciplinary teams and saying, they should be occurring with the patient at the centre of them, actually in person, present, able to be a true partner in their healthcare. So for me, it's much more about we've become partners in what is making our health better than the maternalistic motherhood and apple pie old style of healthcare, which was, I am the clinician, I trained for however long to learn this stuff, so I'm going to tell you what to do. And I often like to point out to the people that try and do that, and there are still some, unfortunately, that do, that whilst they train to become a clinician, I trained to become a patient. So for 50 years now, I've trained to be the patient I am.
Yes. Yeah, absolutely.
So
absolutely. That's a good point,
I am
John.
needing to be a partner.
Yeah. And just to underscore the partner side of things, it's partners based upon equal footing, as you were saying, at least, because patients by lived experience and clinician via academia, if they're both respected equally, only would yield better outcomes moving forward.
Douglas, I'll ask you a question. Have you ever been on a seesaw with your kids?
Yes, I have. Yeah.
Okay. Is it ever fun being on a seesaw and making sure that the other person's feet never touch the ground and you don't change position?
It
doesn't work. It's not. Yeah. And I've got to admit, there are times in life where I want the clinician to take over and to give me the care I need because I don't feel well enough to engage in it. That's me at the bottom of the seesaw with the clinician supporting me. And equally, I want times where I want to be in that power position where I can say, hey, look, guys, I'm doing really well at the moment. Can I make amendment to X, Y, or Z within my healthcare plan? And so we flex our position, but it is equal. It is pivotal and equal. And for me, that is key to how we need to start dealing with each other. It's no fun being on a seesaw when somebody else is keeping your feet off the ground.
Jono, though, that's very demanding. What you've touched on there is a switch to make digital available alongside all the other medium for engagement that may exist. The ability to engage with the patient and discuss their options for which medium to use, and then to bring the patient in as an equal partner, as opposed to the matriarchal subservient model that we often operate now. That's a hell of a shift for the system, if you don't mind me saying, and for patients.
So as far as the change from digital to physical, or the balance between the two, have you ever been in a doctor's office where there hasn't been a computer? No. Not me personally, or certainly not for a very long time. Yeah. So the shift is easy for them if they are able and willing to learn the technology, as well as the patients are having to learn that technology. Yeah. And if they're willing to engage in it, I see no issue with the shift to digital for clinicians. And actually, I think they are doing a very good job of shifting very fast. I think more likely they're likely to go, oh, why do I have to go back to clinics and have people trailing into the room every time? As far as other issues go, for me, if you want to get the best outcome for your patients, you have to involve them. You have to ask those questions of engagement. Again, I'll use my own experience. When I come up against doctors that don't want to do that, I actually stop engaging with them. Yeah. I then pull back and I'm more likely to have a worse outcome because the relationship's not right.
And do you hit on something that's the nub of this, which is the relationship then? Is that we tend to talk in this series, don't we, about tech, think big, act now, when we think about tech. But actually what you're saying is, no, it's something else that makes this work. Tech might be there, but it's something else.
Technology can only ever support. It is there to give emphasis to and ease of access. But what is it giving ease of access to? It's giving ease of access to another human being who is going to look at you and care for you in a supportive way and offer you the support that you as a human being need. When I used to work with the Southwest Academic Health Science Network, with other organisations, We constantly talked about what's the patient experience, or what's the staff experience, or even, well, what's the whole community experience. I'm working with a wonderful organization now in the States called the Beryl Institute, and they've decided to, let's crush those silos and let's actually talk about the human experience. Let's transform the human experience of healthcare and stop siloing people and actually deal with each other human to human. Everybody has an interaction with healthcare at some point in their lives. And if we only did it as human to human, rather than siloing people, we would see outcomes which would far outweigh any cost or negative benefit that would be happening. And I think we've got a great opportunity. COVID, for all its horribleness, has given the NHS and the population of the UK an opportunity to do it differently. And we've got to grasp that with both hands.
I was going to ask you very quickly in terms of the opportunity that you're talking about, and also education, because you know the example you gave of a clinician being resistant to the changes in patient empowerment. Is there room for re-educating the educators so that, you know, the new breed of clinicians come in with a different ethos, different philosophy that can really embrace innovation?
Yes, I really think there is. That the difficulty with the way that the system is currently set up is that the educators of clinicians are clinicians. And quite often it's older clinicians with a lot of experience sharing their experiences. What I would like to see is, again, a partnership between patients, families, carers, the community, and having them involved in the training of GPs and the training of doctors and the training of nurses. And in every single course, we should be placing before these people large swathes of people that are experiencing healthcare in the present right now and asking them to share their experiences. We really shouldn't be all about the degree or the university time. We should be about the people and what the impact and the outcome is. We have to mix and measure those two things equally.
And that's a very good response.
Can I take the other side of education and engagement? Because I think there's also a factor that points to the patient and the patient's role in this. Yeah. Less matriarchal, as you say. How does that shift, Jono? Because actually that helps us in a way to get through the backlog, to deal with these numbers that we're facing. Because I think you're alluding to a different model altogether here. So where's your thinking on that?
So the joy of working with NHS England is we like to name things and we like to give things titles. And currently the discussion is about waiting well. We know that the backlog has been caused, that we have 5 million people currently on the waiting list for non-urgent elective care. Do you want to wait, do nothing, and by doing nothing, more than likely be worse by the time we actually get round to helping you and dealing with you by what you need now? Or can we help you as patients to really grip the problem, help you via things like therapy, physiotherapy, occupational therapy, talk therapies, give you tools as a patient that if you actually work with us as health professionals, we'll actually be able to make your waiting period a positive experience rather than a negative, and more than likely stop the deterioration from where you are now to where you will be when we do have an opportunity to really give you what you need. So waiting well, I think you'll hear a lot more about, and I think it is about educating patients, but also educating staff to ensure that we're giving all the opportunities, all the information, everything about safe, reliable, effective healthcare, and about how you can do the most for yourself in the period of waiting between now and when the healthcare service can deliver what you really need as a final outcome.
Brilliant.
Super. And you do see that in other walks of life when you see people waiting, they're engaged in other activities. Why wait in the GP surgery if you even have to, when you could be filling in the questionnaire and be making better use of your time? Over the last 12 months, have you seen any initiative, anything that stood out within health innovation that said, okay, that was something that was really good and, just blew your mind?
So I've got to say that the Beryl Institute and the Transform Human Experience has really impacted me. But on another, again, pre-pandemic, so before we even got into this, I was really enthused by a project called 1530. And that project, I've got some detail here, so forgive me for looking down, all right? But it came from Daniel Wadsworth and Rachel Pilling from the Bradford Teaching Hospital. And their entire emphasis was, can you as a member of staff or a patient do something that takes 15 seconds that can save a colleague 30 minutes? Now, the classic, and forgive me for how this might sound, but the classic is, you as a nurse give the patient the last sick bowl from the cupboard. The patient uses it, you take it away, but you don't take the time to replace that stock or that stack. The poor person who next feels sick has to wait, and unfortunately is sick all over the bed sheets because they've not had a bowl available to them straight away. That means a colleague of yours is now having to change a bed, care for a patient, look after them. What could have taken 15 seconds to walk down a corridor and help your colleagues by replacing the sick bowl stock has now taken somebody 30 minutes, 40 minutes, whatever it is, because of that. Are there small incremental things that we can do in 15 seconds that will support our fellow colleagues in 30 minutes? And that blew my mind in the sense of, yeah, we just need to think a little bit more, be more supportive, more team players, and more about how can I help and support my colleagues in the work that they do. And as patients, how can I support health professionals to really do better for my health outcomes?
Yeah, because as a patient, I can gather my symptoms. I can look after my health day in, day out in small bite-sized chunks that enable a better diagnosis, that enable me to be in better shape, and I'm easier to operate on, or my disease hasn't deteriorated as badly as it may have.
And again, projects like Ask 3 Questions. When you go to a GP, instead of thinking, oh, when I get there, I'll just tell them everything, think very clearly about describing the problem, asking 3 questions about it, and asking for those things to be given to you really clearly for advice. It's often the way that we, as patients, myself included at times, got into the GP, had a conversation, and as you're walking out the door, go, oh, but the real reason I came was... And then it takes up so much more time. And actually, we really need to be thinking, poor old overloaded GP, he needs me to get to the point. How can I help support that? Here is a quick way of doing it. Make sure I've got my 3 questions in advance that I can ask and get the help I need as quickly as possible.
That's great stuff. And because again, we've got innovation, technology that can help you relieve some of that pressure of remembering all the things that you want to convey to your GP in that small snapshot window that you have. So, Jono, again, we know your time is limited and there's so much useful information that you're distilling. Patient empowerment is not going anywhere, it's just going to increase, and rightfully so. There's technology out there that needs to be embraced to quicken that process. And think big, act now, as I'm taking, doesn't really mean as such just acting now. There's steps that you can take to bring around that change. So we're thinking big, we're acting now through small incremental steps. Then you were talking about education, which is fantastic. So I was fully behind you 100% of the way. Thank you.
Jono.
Thank you very much. And of course, we only do a journey by one step at a time.
Thank you.
So no, thank you very much. Thank you very much.
Jono, thank you.
Thank you.
Good. Thank you, Douglas. Great to see you.
And it's always a pleasure to see you. That was fantastic. it still gives me shivers to hear your narrative and the practical solutions and bringing it home to the people that, the sixth person that we need on the ward is the patient. There's an untapped resource there, full of knowledge. And I think embracing that will make health move forward exponentially.
Yeah, and we don't want to be the reserve player. We want to be the player on the pitch. So for me, it's great to be part of that team rather than just sitting on the bench waiting to be asked.
Excellent stuff. And we've got some great questions coming in there, and some of the comments we have are reaffirming the great stuff that you are distilling to the audience. So Nathan spoke about, he's so glad to hear you speaking about choice and ensuring that people are not disadvantaged due to the very real digital divides. So do you want to say anything about the digital divide? Do you think it's got bigger since the COVID, or what can we do to reduce that gap?
I think rather than getting bigger, we've just realised how big it is. And I really need people to understand the digital divide really isn't just about not being able to access, but maybe it's about not having the skills. And you might have the piece of kit at home, but if you don't know how to use it, that's taking you out as well. So there's a much wider divide than we've ever really acknowledged, but COVID's just shone a light on it, and we really do know how big that is. And there's also some great comments in around things like the library services that are supportive of people who need help to get onto digital services, and those are absolutely available to everybody. So I just want those sorts of messages to get out there, that you're not alone, that there is a way of us helping you, and don't be discouraged by that digital that inability with digital. There are places that can help you.
Brilliant. And as a clinician, I must say this, that you set the bar really high in terms of expectation, and rightfully so. And it's up to the health profession to meet patients on that, because we need to change our practice. Technology will enable connectivity, will enable people to engage, but we need to be able to change the way we work to enable the thoughts, feelings, wishes of the patients to follow through in our clinical practice.
Yeah, and remember what I was saying in that video really about all we're actually enabling is a change in how we get to what we wanted to get to in the first place, which is the relationship between a clinician and a patient being the best it can be, and that we have a way of having completely open conversations and supportive conversations, and going right back to that question at the beginning of what matters to me. What is it that really truly matters to the patient? And I don't care how you have that conversation, as long as that conversation is had and in a way that enables everybody to have that conversation.
Absolutely. And another question from Davina was, giving options is very equitable. We hear that word bantered around in many forums. Various issues can reduce the access to the digital options. So do you want to break that down a little bit?
So let's think about the difference between equity and equality, and being really careful with the knowledge of both of those. We want everything to be done equally for everybody to be able to access, but that doesn't mean we have to give the same resource to everybody. If, for example, if you sent me a brand new tablet, there'd be absolutely no point, because I've got all of that kit at home. So I don't need to be treated equally as somebody who doesn't have that. But I want it equitably done so that the access that's given can be accessed by everybody. So, there's a real difference. And at the end of the day, we're here to support people, and that supporting is of everybody. And that's why I took the conversation right back to that human to human piece. If only we think of each other as another human being who is in a time of need, we would go out of our way to do as much as possible to support that person, regardless of background, capability, financial position, or any other form of what is at the end of the day bias.
Brilliant stuff. And for me, I'm completely in awe of you. Thank you very much for that. There is something about re-educating the educators as well. So all the new cohorts of nurses, doctors, people in social care, anyone that works in the health panacea, understands that the patient is there and is of equal footing in the whole health episode as well. So, Jono, thank you very much for your time. Thank you guys out there for your comments, and all your social handles. We will share those as well, so people can get a hold of Jono. Thank you very much for your time. Thank you.
Thank you.
Richard, how was that for you?
A tour de force. That was amazing. Just a completely different perspective, grand scale reimagining
Yes.
of the relationship between a clinician and a patient.
Yes.
Completely, to my mind. And then granular stuff about what can you do now as a staff member, as a patient, to help the whole journey and improve it. So how did he get from there to there in the space of 20 minutes?
Do you know? Yeah, I think he had a lot of years of experience. As he said, 40 years worth of experience being a patient. That is telling, you know, somebody that has 40 years worth of academia and practical knowledge, and bringing those two worlds to combine into some sort of sweet spot Venn diagram as a future state for health is what is needed. I think it's been underplayed for so many years. It's been tokenized, get patients involved, but I think the COVID situation has definitely demonstrated that, you know, we don't have resources. We will never have enough resources in terms of people employed in health. However, we have an untapped resource that are fully capable of making informed, empowered decisions, potentially care that actually will reduce the cost of the NHS and wider organizations. So I was in awe. I was just listening, and it was going there, but it needs a revolution. Yeah. Richard, we talk all the time about digital transformation. That's what we talk about: innovation, change, all of that. And sometimes people talk about a caterpillar metaphor, changing into a butterfly, completely different anatomically being to what it was as a caterpillar. But that's what this is about. Yeah. If you listen to his story and if those steps are fully embraced, health will be transformed. It will not look like the caterpillar it was before. It'll be we have wings. Yeah,
yeah, because it's not transformation of one not using technology to using technology. This is about the way the whole thing is delivered and the roles of everybody in that setup. But gosh, that asks some big questions of people, and for that reason, people have to watch Jono Broad when he plays, because that will make you stop and think. And if you don't, you're not paying attention.
Absolutely. I enjoyed it. I'm still shaking now, so I'll replay it. And there's so many take-home messages that we can do straight away. You know, stop thinking about yourself as a silo. Think about the whole system. Yeah. In our generation, we know that health is morphing into just care. Yeah. So thinking about your ward is not good enough. You've got to think about the community teams, think about voluntary services, think about the patient, all of these things. So, yeah, what can you say? Tune in, guys.
See you soon.
See you later. Take care.